If we suspect that a child might be struggling, what are some of the practical ways that we can help the child?
For us, I guess, having that high quality education and care service. So knowing that that's a safe space for the child. Secure attachments with significant others, whether it's a teacher that they trust, whether it's an educator they trust, whether it's, a family member, working with the family as well. So making sure that that they're included, that they have access to support services too. So when children are at risk, we try to put in the protective factors. There is a couple of tools on the BU website that are free for every educator that you can download and sign up. So one of them is the BU Mental Health Continuum, and it outlines developmentally specific signs and their, of when children may be indicating that they're on the continuum, where they're sitting and if they're struggling. And there are specific versions for early years, primary school, and for adolescents, because BU stretches from birth to 18. Sorry, talking with my hands. It's a continuum. And in relation with that, there is another tool that we call the BERELS tool. So BERELS stands for Behaviours, Emotions, Thoughts, Learnings, and Social Interactions. And that's a tool that gives a complete picture of what's occurring for that child within that setting. And it's a really good tool that you can use in every setting. You can use it in schools, you can use it in the school aged care. If you have an early years centre within the school, it's good there. And it gives a really good complete picture of what's occurring for that child. And it's an easy tool. There are instructions for every educator to be able to use it too. So that's a practical way, and it's an easy way for educators to feel that they have something that they can control before it has to go to further assistance.
I think it's important though, because I think it's practical. The key word in that question was about it being practical, because it's great that we can talk about kids and we can, refer or do whatever it may be, but what is it that I can do in the moment to either affirm or not my hunch around a child in terms of their struggle continuum, as you explained.
Yeah, on the mental health continuum. And, remembering that some things may be short term, and struggling can be a short term thing, but remembering that a child can then move back up that continuum to going okay or flourishing is a good thing too. So it's not the be all and end all when they're struggling. It can actually move up that continuum, and working with the families to provide strategies on the child's likes and what the child's strengths are and how to build that resilience with the child can assist.
If we're suspecting that a child might be struggling, we need to have a look at that behaviour and try and understand what they're doing with that behaviour. So again, if they're avoiding a situation, why are they avoiding that situation? If they're acting aggressively or defensively, why are they doing that? There's always a reason. It might not be obvious as an educator trying to understand what a 7-year-old is doing, but there is a reasoning behind it. And I guess as far as a practical way, it'd be looking at how that educator or that teacher can change the routine or the structure within that lesson or within that situation to prevent that from happening. So, if there's an issue with transitioning from one room to another, how can we prevent that from occurring? So whether it's changing that transition or moving the transition, I think there's some small things that we can do which can help prevent some of those negative behaviours from occurring.
It's about when these new transitions back into school and about those new relationships that are going to have to be rebuilt and re-establishment of those relationships and where people are. And what they might have been doing at home was not concentrating on the curriculum, more looking at the dispositions of learning, about their critical thinking and their problem solving with the parents.